For patients who may be seeking breast reduction surgery and they may want to know what types of breast reduction procedures are available, it really depends upon what your starting anatomy is like. Typically, all breast reducing procedures do involve performing a breast lift. When we do a breast reduction surgery, there are different ways that we perform the operation to make sure we maintain blood supply to the nipple and the areola and to make sure we minimize wound healing complications where the incisional edges come together. I perform a pretty particular type of a breast reduction technique, and I am always happy to educate patients on why I think this technique is a better technique than some of the other techniques that are available in breast reduction surgery that tend to lead to more common, less optimal outcomes like upper pole hollowing and scar widening. Candidates for breast reduction surgery are typically patients who have breasts that are larger than they want them to be. I would say the most common complaint that I get from patients who have breasts that they feel are too large for their frame are just that. They feel their breasts are too large for their frame. Usually that's an indication that these breasts are interfering with their ability to perform active activities like athletic activities, outdoor activities, wearing clothing that fit appropriately. Sometimes I'll have a lot of patients who say, I feel like I look like I weigh 30 pounds more than I do, and it's all in my breast. These are all indicators that you may benefit from a breast reduction surgery. In choosing a breast reduction surgeon, number one, you want to make sure that this surgeon is certified by the American Board of Plastic Surgery. You also want to make sure that this surgeon has admitting privileges in a hospital, a local hospital, where if a patient would need to be transferred, that surgeon can follow you there. Both of these are indications that that surgeon is at least at minimum a safe surgeon that the hospital deems to be safe enough to have privileges in that hospital. Beyond that, I would recommend asking to see before and after photos to make sure that the scar quality is good, but also that the overall shape of the patient's breast and areola are nice looking and aesthetically pleasing. I think that choosing a breast reduction surgeon who has a strong passion for doing good breast reduction surgeries is also very important. Sadly, because insurance does pay for some patients' breast reduction surgeries in very rare circumstances, there are some surgeons that treat it like a lesser surgery because they're only going to be paid by the insurance a certain amount of money. I would highly recommend choosing a surgeon who is very passionate about getting great results with their breast reduction surgery outcomes. Breast reduction surgery, when I perform it, typically takes me about 3 hours to perform. It's usually about 2 hours and 40 minutes or so of operating, and the rest of that time is spent putting the patient to sleep and waking them up. Usually you go home the same day, and we typically see our patients here 1 week after surgery, after the day after surgery, and then at 2 weeks, at 6 weeks, and 3 months.